All right, welcome back to the space. Now, if you didn't know, today we're talking about erectile dysfunction. 50% of a man's confidence is placed in his penis. We're not saying this to be funny, but unfortunately it's true. A man's sexual performance is held to the highest degree in his mind as well as among his peers. Aside from money and power, your ability to perform in the bedroom is one or a key fundamental structure of a man, and you'll find out why.
So the thing is, we know the conversation about length and girth has come up in the conversation, or either during texting or always comes up. So which one really matters? So we brought up the conversation on erectile dysfunction, so your penis doesn't disappoint you when the time is right.
And we're hoping to have a conversation around erectile dysfunction where these conversations become common amongst other men, because even amongst men they don't discuss this thing, and if they suffer from it, they're suffering in silence. And on top of that, people tend to think, or at least old school way of thinking, is that erectile dysfunction is a disease for the old. It's really not. I mean, it is generally, it affects men between the ages of 40 to 70, majority anyway. But that doesn't mean it doesn't affect young men. In fact, studies show that there's been an increase in the number of young people that are having erectile dysfunction.
There's actually a study that was done here in Namibia that revealed that people as young as 17 could have erectile dysfunction. Not that 17-year-olds should be having sex, but it happens.
It does. We're not here to judge. All right, Phil, please define for the people at home what erectile dysfunction is.
So simply put, erectile dysfunction, or ED, is the inability for you to get and maintain an erection long enough to culminate into sexual climax, either for you or for your partner.
Now, in simple terms, an erection usually is dependent on blood flow, yeah? You have tiny blood vessels within the penis that rush and fill up with blood that causes the erection. And when the man ejaculates, the blood gushes right out of the penis and it becomes flaccid again.
Basically, what Alex is saying is that erections are really, really complicated. I mean, they involve your heart, your lungs, your brain, your eyes, blood vessels, all of that stuff. So essentially there's so much that goes into getting an erection, and it's a multi-system sort of process. So Alex, how long should an erection last?
So when you put all these things together, an erection, at least on average for men, it should last between 2 to 3 minutes or even up to half an hour. And to put it in context, when you're sleeping, you're having about 4 to 5 erections, and these usually last between 25 to 35 minutes, and I'm sure you've noticed them when you wake up. But should your erections last this long? No, and Phil will tell you exactly why.
See, the thing is, we give such a vague number because I don't think anybody has ever awkwardly just got 1,000 men with a stopwatch and set them down and just time their bonus. That's
up to this very second.
It's weird.
No, nobody has done that. Okay, so what's our point? If you're having unsatisfactory sex, whether you or your partner, whether it's how long the erection is or how hard the erection is, you're probably suffering from erectile dysfunction.
That's facts, no printer. And here's more facts. There's 3 types of erections. You have the reflexive erection, where it comes from physical stimulation of the penis, and then you get psychogenic erection, which comes from visual stimulation of the penis, and then you get nocturnal erections, which comes from, basically these are called morning wood.
If you've ever tried to pee in the morning,
you're welcome.
You know what I'm saying.
Vertically.
Like literally horizontal, that is the hardest thing to do. Anyway, next.
Now that we have a broad understanding of what erectile dysfunction is, now we need to delve into the causes of it. Right? So the root cause. So we classify the causes into 2 major groups, which include physiological and psychological causes. So psychological, we're talking about the mental, and physiological, we're talking about the body and the various chemical processes that happen in the body. So Alex will take us through.
So let's start with psychological. And as you said before, your emotional state takes a large part of this. Now, a lot of young men who suffer from erectile dysfunction usually have psychological factors as a reason for the erectile dysfunction. And you'll find out why soon enough. It goes without saying that if a man is not mentally aroused by a woman, he's not going to have an erection. Now, this, along with stress, depression, and anxiety, are a big reason why men don't have erections or perform in the bedroom. Unless those sources or those things are sorted out, your man will probably continue suffering from erectile dysfunction.
Now the conversation comes or zones into young men in the digital age where we talk about, send nudes, and we talk about Pornhub, we talk about X videos. So it says that some people speculate that the young men, the modern age millennial, is desensitized to the female physique, so they do not get sexual arousal from that. Other people talk about, practice makes perfect, so the more you see, the better you get at it. So we're quite interested in what you think, so let's discuss.
Exactly.
What do you think?
Internet porn is a big deal these days, and it's among a lot of young men, so it definitely, I think there's an argument for both sides, but let us know what you think. Now, another thing we're going to go into is physiological causes. Physiological causes are basically the chemical stuff, or what really goes wrong in your body that can cause an erectile dysfunction. The first thing that we're going to mention is neurogenic factors. Now, neurogenic means the nerves, the nervous system, basically. For example, if you had trauma to the spinal cord or something happened to your brain, like a stroke, there's definitely going to be impairment between the connection from your brain up to the penis. So as a result of that, because there's no connection from the two, you'll probably suffer from erectile dysfunction because one and the other are not communicating. Also, if you've had trauma, like pelvic trauma from an accident or something, or trauma to the penis itself, it'll definitely hamper your ability to have an effective erection.
So another factor in the conversation of sexual performance is the hormones. So the hormone we talk about in males is testosterone.
Yeah.
So testosterone is responsible primarily for your secondary sexual characteristics. So this includes your physiques, your shoulders, your muscle bulk, includes your pubic hair, your facial hair, your voice. So in males, and then so later on in life, as the older you get, the less testosterone you produce, and therefore this is why sexual dysfunction is more common in older people than it is in younger people. But we also talk about situations where you're born with the inability to produce sufficient sexual hormones, such as testosterone, which is called hypogonadism, where people have sexual dysfunction in that regard.
Substance use is a category in which a lot of young men fall into, and this is where a lot of young men who are suffering from erectile dysfunction usually find some of their risk factors as well. Now, smoking has never and will never be beneficial to the body. In fact, we will probably do an episode on its own, but it basically affects every system there is, from your lungs up until your penis, because it does cause erectile dysfunction. Now, smoking on its own decreases the size of your blood vessels all over your body. And if you understood my explanation of how an erection occurs, you definitely need a whole lot of blood flow to maintain an erection. So don't smoke, and just either work on quitting or work on minimizing, because that's probably a cause of your erectile dysfunction.
We can't talk about the guai and not talk about the alcohol.
Yeah.
Alcohol is a depressant. Alcohol dampens your desire, and it also dampens your ability to maintain an erection.
Yeah.
So if you look back most of our episodes, we talk about how alcohol affects multiple systems. So once you start experiencing erectile dysfunction, then you perhaps need to cut down on the amount of alcohol you're taking. Another factor is other substances such as medication, which include high blood pressure medication as well as antipsychotic medication. Yeah. So if you are experiencing erectile dysfunction in any of these medication, you need to visit your physician, and then they review your prescription.
Yeah. Especially that last part. Don't just stop your medications. Go and have a talk with your doctor so that they can just work out how to find a balance between the two. Another factor we're going to talk about is diabetes. Diabetes is the second most common cause for erectile dysfunction. It's we find a lot of it in our system, or in our society, I mean. Now, here's the thing. Diabetes is broken down into two factors. We have type 1 diabetes, which usually affects young people, and type 2 diabetes, which is usually diagnosed later in adulthood, and this usually affects older men. The key to controlling erectile dysfunction when you have diabetes is sugar control. Once your blood glucose is controlled, then you probably won't suffer from erectile dysfunction.
So erectile dysfunction is primarily a disease on the physical concept. Erectile dysfunction is primarily a disease of the microvasculature. So these are the small vessels in the penis. So when you get damage to these vessels, then you can get erectile dysfunction. So the main causes of now microvasculature damage in people is, like Alex said, diabetes. You can also get from smoking, you can get from hypertension, you can get from a high fatty diet, or dyslipidemias. So we talk about what is called metabolic syndrome. So people with high body mass, obesity. So these are people that can get erectile dysfunction. So once you start experiencing erectile dysfunction, you need to be worked up for some of these causes so that we can address it.
Those are basically some of the causes wrapped up into psychological as well as physiological. Read up on some of them if you do have questions on some of the factors or risk factors, please definitely either private message us or DM us or put something in the comments. We'll definitely try to get back to you.
Sure. Now, before we talk about the treatment of erectile dysfunction, we need to talk about other bedroom issues that affect that result into a poor sexual rhythm.
Yeah, what is he talking about? Well, aside from erectile dysfunction, men do have other things that can occur in the bedroom that sort of lead to, poor sexual performance. And these include premature ejaculation, decreased libido or sexual drive, as well as penis size. Excuse the pun, but it's not really such a big deal, but you're gonna find out later what we're talking about.
So premature ejaculation is self-explanatory. It means ejaculating prematurely.
Yeah.
This means the man comes or releases semen before either of them reaches sexual climax.
Yeah.
So it's essentially 5 minutes of fame.
Seconds rather. But no, the issue here is hypersensitivity, really, of the glans. Now, if you don't know what the glans is, it's basically the tip of the penis, and it usually is laid with a whole lot of pleasure receptors there. During sexual performance, hyperstimulation of this area usually causes ejaculation, and in this case, premature ejaculation. Alright, the next thing we're going to talk about is penis size. Now, does size really matter? Well, yes and no. You see, when it comes to erectile size, right, or penis size, men are divided into two classes. You're either a shower or you're a grower. Now, the shower usually has a large penis, even though it's not erect, while the grower has a large penis once it's erect, and once it's flaccid, it comes back to a more neutral size, let's say. But yeah, these are the two classes we have. Phil?
With the shower, there isn't really much of a difference in the flaccid state and the erect state.
Yeah.
So these people do not have much of a difference in that regard. And these are I pulled it out and she ran.
Actual elephant.
Anyway, as I was saying, so does size really matter? So from the little social inquiry that we did, size matters, but what matters more is the frequency and intensity. So you're better off working on your stroke game than you are working on your size.
There are actual people who have smaller than average size penises, and for these people, growth is attainable. And we will talk about this further in our treatment section. But yes, this is a very small population of people. Now, for erectile dysfunction that is psychologic or mental in its origin, it's fair to say that the erectile dysfunction will persist for as long as the person is within this mindset. What do I mean by this? Well, the man will continue having erectile dysfunction for as long as he's stressed about his work, stressed about money, stressed about marriage problems, unless this mindset changes. And if this is the cause of the erectile dysfunction, nothing else will change in the bedroom as well. Now, for men who have actual, more serious mental disorders, let's say anxiety disorders, major depressive disorders, stuff like that, they need to be treated by an actual psychiatrist who needs to put them either on antidepressants or on anxiolytics. These are medications that deal with anxiety. So unless this is medically treated, you're probably still going to have these erectile dysfunction disorders.
So talking open with your partner goes a long way in the bedroom. Talking about your likes, your dislikes, your fantasies, your fetishes, and areas or regions that you should not be crossing in the bedroom goes a long way.
Another thing I wanted to talk about is erectile dysfunction can actually improve with simple changes in your lifestyle choices. What do I mean by this? Well, by exercising, improving your diet, drinking a lot more water, doing simple healthy changes to the practices that you actually don't usually do could actually go quite a long way as well, because you will notice that erections improve the healthier you are.
Right, so now we're going to talk about the more interesting part of the treatment of ED, which involves the medication. This includes commonly what is called Viagra, or the blue pill, or Cialis, or aka the brand name, the generic name is called sildenafil.
Yeah.
Other drugs in this class include tadalafil and
Vardenafil. Alright. Now, how do these drugs work? These drugs work by causing you to have and maintain an erection for a much longer time than required. I mean that you need it for anyway. What's important about these drugs is, though, you still need to be stimulated sexually before you have this erection. So arousal is still very important to the use of these drugs.
So let's talk about the blue pill or the golden pill of Viagra for a little bit. You see how important it is. There's so many nicknames. So Viagra should be taken 30 minutes to an hour before anticipated sexual activity. Once Viagra is taken and sexual intercourse is, sort of embarked upon, you can get a good 1 hour to 4 hours of an erection. This should be long enough to satisfy just about anybody.
Anyone.
Think mammoth muscle. So it is important to note that these medications have certain side effects. Therefore, you should have a full evaluation from a doctor before you start taking any of these supplements.
Side effects include dizziness, fainting, and it actually can also cause quite a strain on your heart. So in fact, this is why it's not a permanent solution, because at the end of the day, if you suffer from extreme side effects of this, you could actually end up developing heart failure later as well. So there are contraindications as well to these drugs, so please do make sure you see your doctor before you start taking this or before they prescribe it to you.
Other medical options include injection of a chemical directly into the penis, but this is self-administered, but the first couple of doses are administered under the supervision of a medical practitioner. So this should give you a good 3 months of decent bonus.
So one other thing you can do, and it's a pretty handy gadget, it's called a vacuum pump. So it's a cylindrical pump that has a pressure bulb attached to it. Basically, you put the erect penis within the cylinder, and you create the vacuum with the pump. Basically, as the vacuum is being created, it sucks blood into the penis, causing the erection. Once you have an adequate erection, you take this little piece of rubber band, and then you place it at the base of the erect penis. Now, this should maintain your erection, but please do not keep this ring on. It's a constriction band, by the way. Do not keep it on for longer than 30 minutes because you might actually suffer tissue damage on the penis.
So for those suffering from low libido or low sex drive, as we identified earlier, the problem is a low testosterone level. So basically the treatment for this is supplementation of testosterone, which can be in a multitude of forms, from tablets to injections to creams that help raise your testosterone level and thus your sex drive.
Basically it. And those of you that actually suffer from premature ejaculation, like we said at the beginning, the problem here is hyperstimulation. So what you can do is use topical anesthetic creams at the top of the glans, or there are pills as well that can help just decrease the sensitivity around the glans a little bit. But the preferred treatment here is a combination of both cognitive behavioral therapies as well as medication. Basically, it's sort of like behavioral techniques that are used to try and decrease the hyperstimulation during sexual intercourse, and that should help with premature ejaculation. Also, for those of you, again, who do entertain the thoughts of increasing your penis size, just be cautious on this, because the surgeries and the medications that are available are quite risky and sometimes do not work. So definitely think of consulting a specialist in this region before just embarking on some penile enlargement adventure that you found on the internet, because it could be quite costly. So on top of that, penile enlargement is an achievable thing, but I think you should just try and get a professional's help before you just randomly embark on it. So, in summary, that is all we have on erectile dysfunction. It really is a very culturally sensitive topic, especially to men, but don't suffer in silence. There is treatment available out there. If you do suffer from it, do see somebody about it, because it definitely causes a lot of relationship stress and a lot of relationship problems, so it needs to be handled.
So if you want to take the discussion further, if there's an aspect of the show that you'd like to discuss in depth with us, hit us on our social media pages at the third space _ on Facebook, Instagram and Twitter. That's at the third space on Instagram, Facebook and Twitter. And follow our YouTube channel where we post videos related to anything that affects your health and everything else in between. So I hope you learned something from the show today. My name is Phil.
I'm Alex.
And this
is the third space.